There's a paradox that on the one hand, I'm glad we're paying attention. On the other hand, the more we worry about whether we're getting our sleep needs met, the harder it gets to meet them. Oh my gosh, I read somewhere I was supposed to get 8 hours of sleep and I only got 6. Oh, this is really bad. I'm going to be sleep deprived. And then the final thing that you talked about too is timing of sleep also impacts us.
Getting enough sleep is one of the most important things that you can do for your overall health and well-being. Dr. Cindy Geyer joins us today to discuss the stages of sleep, challenges to adequate sleep, and how sleep deprivation affects our bodies. Stay connected to discover healthy options that will help you sleep better. As always, full bio and links for all my guests are found in the show notes, and I hope that you enjoy this episode.
Thank you so much, Maya. It's an honor to be here. I'm so grateful for the work that you're doing of spreading the word about lifestyle and how it can help people's health and wellness for everything.
Now, we're going to talk about what sleep looks like, what impairs or causes some of that sleep deprivation, how women throughout life are impacted when it comes to not having quality sleep, and then what we can do about it. So I'm so grateful that you are going to contribute to that. So I think this is going to be very valuable. Before we talk about sleep, can we learn a little bit more about you, your background in terms of how you became interested in lifestyle medicine? You're very involved in functional medicine, working with Dr. Mark Hyman at the Ultrawellness Center. So please tell us more.
I think it's kind of an interesting story. I did my residency at Strong Memorial Hospital where they pioneered what was called back then the biopsychosocial model. And I didn't realize at the time just how groundbreaking that was, but it's basically looking at beyond just the medical diagnosis of somebody, but the people coming in to see you have a context. They've got a social life, they've got psychological and mental and emotional feelings about things, and they've got a story. And I think that underpinning of looking at people as a person as opposed to a disease was really foundational and has informed me going forward. I also, after I finished my residency, I came out to the Berkshires, which is a beautiful part of Western Massachusetts. And I was a teaching attending because one of the things I also wanted to do was continue to learn. And that was back in the day when we followed our patients in the hospital and did night call. So I had a lot of my own experiences of being sleep deprived, which I'll talk more about. I think we get passionate about what we experienced ourselves, right? And I think I went through my own. I was sleep deprived. I had children. I tried to figure out work-life balance, and I ended up taking a part-time job at the emergency room instead of doing a teaching practice, and that was not a fit. So I had additional experience about stress and sleep deprivation and some physical issues. Long story short, the opportunity opened up at Canyon Ranch, which is a destination resort that has dietitians, physical therapists, exercise physiologists, etc. And I didn't know much about that piece, but what I knew is I wanted to go back to listening to people's stories and spending time with them and finding out who they were. So fast forward, I got very interested and have learned a lot along the way from a lot of my interdisciplinary colleagues. The whole lifestyle piece, what I was amazed by is how much people could transform their health and their lives when they were immersed in an environment and eating delicious food and trying an exercise class and attending to their stress and doing a breath-based practice. And what they were able to accomplish in 3 or 4 days was amazing. And I continue to be just honored to be able to do that kind of work. What's interesting about the American College of Lifestyle Medicine is when I was teaching food as medicine 20 years ago, we had to spend a lot of time and energy trying to convince doctors that the food you ate actually mattered in terms of your health. So that was where our energy was. It wasn't how to make it happen. It was convincing them that, yes, it really does matter. And when I heard about the American College of Lifestyle Medicine, I said, look, if there's an organization that's really making this front and center of educating health practitioners, I want to be a part of it. And I've been overwhelmed with the amount of work they've done in the last 5-10 years in terms of taking what lifestyle was. It was for people who could afford to pay to go to a nice destination resort and spend a lot of time and energy on that, but really making it accessible to everybody. And I'm just so grateful for the opportunity to have a foot in both worlds. And now I'm at the Ultrawellness Center, where It's, again, people looking for a deep dive into what's going on with their health and well-being and symptoms that they maybe can't explain. But at the root of it all, we come back to the basics. It's about how they're eating, how they're moving, how they're managing their stress, sleep, and their connections to other people. So there's a lot of overlap.
I feel that when it comes to sleep, we sort of feel like that's the one thing that we put off till the end. And when we are trying to fill so many things into our schedule, it's like, okay, I guess I have to now go to sleep for a little while. And so I found it interesting when you were speaking about in your chapter that women are affected. Through all age or stages of their lives. And then we'll get to that point. But I found it interesting when you were talking about, for example, young women because as we were growing up, we didn't have access to cell phones or social media. So we were not impacted as much. But now it's part of the culture that young women are very stressed about that, especially how they're impacted through social media, how they might lose sleep. And then those instant messages or just texting back and forth, how that can really disrupt sleep. I know that I have myself a habit of what else do I, okay, should I check my email one last time before I go to sleep? What exactly is sleep? And what stages are important?
Sure. So I think when we think about sleep, one of the big shifts is it used to be, as you articulated, viewed as wasted time. It's the time when we weren't getting our stuff done. We weren't being productive. And there is a shift. We now know that sleep is critical for mental, emotional, and physical recovery. So think of it as the time when we're paying back our sleep need for the next day. We're repairing the tissues and muscles that we've used during the day. It's the time when our brain is actually clearing out debris through this newly discovered lymphatic system that it may have accumulated during the day. So it's kind of cleaning house and mopping everything up. And it's restoring alertness so we can come back the next day and feel good and be productive. So it's now no longer being viewed as wasted time, which is great. You also highlighted something else. There's a paradox that, on the one hand, I'm glad we're paying attention. On the other hand, the more we worry about whether we're getting our sleep needs met, the harder it gets to meet them. Oh my gosh, I read somewhere I was supposed to get 8 hours of sleep and I only got 6. Oh, this is really bad. I'm going to be sleep deprived. And then the final thing that you talked about too is timing of sleep also impacts us. So when we think about sleep, it's quantity, meaning the number of hours in bed or that you're actually sleeping. It's quality, which is not just the sleep stages that you talked about, but also how interrupted that sleep is. And the third one is timing. So I'm going to start with the timing piece first, because I think that sort of underpins everything else. Everything in our body runs on a circadian clock, roughly a 24-hour clock. And we're most familiar with the sleep-wake cycle as being one of those. And there is a master clock in the brain called the suprachiasmatic nucleus. I don't love the term master clock, but it's responsible for coordinating biology and behavior on that circadian rhythm. And it is exquisitely sensitive to light. So part of that is sending signals to the brain to start releasing melatonin a few hours after dark. And that signals the body and the brain that it's nighttime and that it's evening, and everything sort of gets into that rest and relaxation and restoration mode. There are also clocks in our bodies. Our cells have clocks, our organs have clocks, and those can be impacted as well by food and by exercise, which is going to be an important piece to this. But keeping that circadian rhythm consistent, so ideally we're going to go to bed at the same time every night, get up at the same time every morning, helps keep our bodies in a nice natural rhythm. In terms of quantity of sleep, there are variables. There's a bell curve of normal for sleep needs, just like there is for everything else. Most adults are somewhere between 7 to 9 hours. So that 8 hours is smack in the middle of the bell curve. But it's also important for people to know what their sleep needs are. Because if you read somewhere you're supposed to get 8 and you're a 7-hour person and you're constantly thinking, wait a minute, I'm only getting 7, then you might feel like you're not getting the sleep that you need when 7 may be perfectly fine for you. Does that make sense?
Absolutely. I tend to be a night owl, which I tend to worry about that now because, like you said, the more we worry, the worse it gets. You will go into more specific details about why we need to sleep. And one of them was detoxing.
Well, actually, that leads me into another important thing when you said you've always been a night owl. So in addition to that master clock that's sensitive to light, that's kind of coordinating everything, there are genetic differences in our so-called chronotype. There are some people who've always been night owls. There are some people who've always been early birds, the larks, and there's some people who are kind of in the middle. So there is a genetic piece. And one way that people can have a sleep debt is if they're fighting against their chronotype. And it can also be misdiagnosed as insomnia. So think about it. This, if your normal rhythm is to fall asleep at midnight, and that's just what you're used to, we'll talk about how you can shift that chronotype a little bit. And you say, okay, for me to get my sleep, I'm going to go to bed at 10. You go to bed at 10, your brain and body aren't ready. So you toss and turn and toss and turn and toss and turn and say, oh, I must have insomnia. It takes me 2 hours to fall asleep. And you go see your doctor and get a prescription for a sleeping pill when you actually need to change your circadian rhythm. and anybody who's been a parent also knows that there is a shift that happens at puberty. So teenagers are the classic ones that shift to be night owls. And right off the bat, you've got another area that affects young girls and boys too, is that unfortunately, you hit middle school and high school, and they often have to start earlier than grade school. So you have a biological shift that coincides with puberty where they skew to be night owls, and now they have to get up earlier in the morning to go to school. So they're stuck in a chronic circadian rhythm mismatch. And we now know that that circadian rhythm mismatch for kids or for teenagers can exacerbate depression. It can affect focus in school, attention, behavior, more likely to gravitate towards substances. So it has a huge impact. And there have been several years now that many major medical organizations have been trying to go to bat and say we really need to have later start times for middle school and high school.
I taught elementaries. I don't do well at 7 o'clock in the morning, which is around the time that I would, show up at school. And so I had to be very, and I'm reading to my students and I'm trying to be very interactive, but I sort of wake up more around 9 in terms of being functional when I'm at work. When I was teaching, I'm a better person at 9 o'clock in the morning as opposed to 7 o'clock. But I'm glad that you'll talk to us about how we can shift that because I have had, and I wonder how many people are like me. I really do struggle with the idea of being a night owl. I also find it very comforting at that time to kind of be up when life is not as busy. I'm not answering phone calls. I might be
Yeah.
answering emails, but I'm not multitasking. I'm not running errands. It's a time when I can just really slow down. Now I understand that there is a certain way that we want to lean towards to really take care of ourselves when it comes to the quality of our sleep.
Some people are able to shift their occupation to match their chronotype. So if you have the luxury of being able to do that, that you don't have to start work till 10, for example, and you can allow yourself to sleep from 12 to 9, and that works for you, that's great. But a lot of people don't have that luxury.
Mm-hmm, mm-hmm.
And I think there's a couple of things you touched on the screens and the phones. I honestly believe that's one of the biggest modern saboteurs of good quality sleep. Because remember that master clock in the brain, it's very sensitive to light. So even if you've got the blue light filter on your phone or the night shift on your phone, it's still light. And a lot of times when you're on your phone or you're on your device, it's also activating content. You're thinking about work emails, you're thinking about deadlines or something that you've got to do or produce. So all of that makes it harder to fall asleep and stay asleep. And I don't know, from a scientific standpoint, I can tell you what I've seen in my practice is that people will say, well, I use my phone all the time and I never have trouble falling asleep. I fall asleep just fine. That may be because you're tired enough that you're eventually going to get to sleep. But melatonin has this nice curve throughout the night. And if you're suppressing or delaying that melatonin curve, the second half of the night, when you wake up because you've partially paid back your sleep need and now you're trying to get back to sleep, it may actually show up with the second half of the night having a harder time falling asleep.
Dr. Geyer, as we move in to talk about the different stages of sleep and the
Mhm.
importance of that, you yourself have battled with sleep deprivation. Can you tell us a little bit about that?
Yeah, I used to say I spent most of my adult life tired, but I always had an excuse for it. As many physicians who did medical school and then residency and then hospital call. And then I had babies I had twins and they were underweight in the beginning and nursed every hour and a half. So that was kind of a blur the first 6 months of their life. So I always had a reason to say, well, I'm tired. I was one of those people who could fall asleep at the drop of a hat in a meeting in the passenger side of a car. Whenever I traveled, I'd sleep the whole way, which made it kind of nice. And I hit a point when they were in elementary school, when I was in the pickup line about 3 in the afternoon. I'd left work and I went to pick them up and I fell asleep in the car waiting to pick them up. And that, coupled with the fact that I was snoring so much, my husband couldn't sleep in the room with me anymore. He tape recorded me and played it back, which was mortifying.
Oh my goodness, I can't imagine that.
And we are going to come back to that. But I said, okay, you know what? I need to get this looked at. So I actually went in for a sleep study. And the sleep study, interestingly enough, I did the full bells and whistles, attended polysomnogram overnight in a sleep lab with a tech in the other room and EEG leads on your head and something. It's not your best night's sleep. And it showed that I did not meet criteria for sleep apnea. So sleep apnea, you have to show evidence of slowing down your airflow at least 40%, at least 10 seconds length and duration, with a 3 or 4% drop in oxygen, depending on whose criteria you're looking at. And anything less than 5 is considered normal. And I was just under 5. 5 to 15 of those episodes per hour is called the AHI, or apnea hypopnea index, is mild sleep apnea, and 15 to 30 is moderate, and anything over 30 is severe. So mine was read as normal. What the EEG showed, well, actually, I should probably share this first. The tech came in the next morning after my study, and he shook his head and he said, "Your husband's right, you snore." And I said, "But just on my back." And he said, "No, you snore all the time." I was like, okay.
Wow.
But it was an interesting example where the snoring did not say, it wasn't sleep apnea. So that's also an important thing to keep in mind. But what the EEG showed up is that my snoring and my working harder to breathe with those snoring events was interfering with the continuity of my sleep 27 times an hour. So that's a pattern that's called upper airway resistance syndrome. These lesser respiratory events that don't meet the cutoff for an apnea hypopnea event, but they're interfering with the continuity of your sleep multiple times an hour. And when I was at Canyon Ranch, I worked with Dr. Dedia, he's a sleep specialist, and he was there as well. And one of the analogies he used to use for that, it's like somebody waving a feather under your nose every minute or two, where you might kind of do this and not wake up to be aware. But if somebody did that to you all night long, you'd be pretty exhausted. And at the time, I was premenopausal. We said, okay, it's probably your allergies, treat your allergies. All right, I'll use my nasal spray and my antihistamines. But I didn't meet criteria for treatment. So after menopause, my fatigue was no better. My snoring was no better. After menopause, I went back and did it again. This time I actually used a home study. And now I had 9 events per hour. So I met criteria for mild sleep apnea. So that's another conundrum, right? If you've known anybody who's tried to deal with sleep apnea, the treatments can be challenging. And the term mild conjures up, it's not a big deal. But you also have to look at what I was coming in with. I was exhausted. I was falling asleep when I wasn't supposed to, and my husband couldn't sleep in the room with me. So I was being significantly impacted by this. So I ended up going through treatment. I tried a CPAP, and then I now have a mandibular, it's called a mandibular advancement device. It's not sexy, but I have to be honest, it has changed my life. It pulls your jaw forward, keeps your tongue from blocking off your airway, keeps me from snoring, and better yet, I wake up without my alarm since I've had this for the last 10 years, and I never did that my entire adult life. And the reason I'm sharing that story in part is that got me really, really interested, right? And it also exemplified some of the things that are pretty unique to women. The first is Believe it or not, we deny and underreport our snoring when women do snore. And some of that may be societal, right? We're embarrassed. We don't want to admit. And I share that story because I don't want other women to not seek the help they need because they're embarrassed about their snoring. The second thing is that upper airway resistance pattern is also more typical for women. So there's a little bit of a challenge in terms of, well, what do you do if you have it? You need to work with a sleep specialist who's very familiar with that, what's called phenotype, that way of showing up with sleep studies and figuring out what to do and how to get you relief. Because when they've looked at women's reports of subjective daytime sleepiness with that kind of pattern, they are just as exhausted as people with more severe apnea, hypopnea indices. So it has a huge impact on quality of life. The screening scores, the screening tests that people often use for sleep apnea, underestimated in women. One of them is called the Epworth Sleepiness Scale. How likely are you to fall asleep in certain conditions? If you're passenger side in the car, I think I had a pretty high Epworth score, but a lot of women don't. If you're in a boring meeting or you're not being stimulated. Another one that's commonly used, the Stop Bang questionnaire. You get extra points if you're a man to make it more likely that you've got it. So it gets missed in women all the time. So long story short, I got very, very interested. And as I delved more deeply, you find out that there are other unique characteristics that disproportionately affect women. Women face a lot of challenges around sleep. The research is somewhat mixed about the hormonal component to it, but there does seem to be one. Because the discrepancy between things like insomnia and restless legs starts to diverge at puberty. Before puberty, girls and boys are about the same in terms of their objective sleep and subjective sleep, but at puberty that diverges. That's also when we start to see more premenstrual symptoms. There can be premenstrual mood shifts, and not surprisingly, that can also affect sleep. Menstrual cramps, if you're in pain, that can negatively impact sleep. The increase in sleep complaints for young girls isn't solely explained by the increase in anxiety and depression that we see, but they are interrelated. They connect with each other. There's other times in women's lives when their hormones shift, and it's also associated with more prevalent sleep disorders. Sleep apnea goes up in pregnancy, in part because of the physiologic changes that happen with pregnancy. And unfortunately, if there's, and it's more common in women who are already overweight before they get pregnant, that's a risk factor. But sleep apnea in pregnancy is a do not miss because it's associated with adverse pregnancy outcomes. Gestational diabetes, pregnancy-induced hypertension, preeclampsia, eclampsia. So it's important for OBGYNs to have it on their radar if somebody reports snoring, if they were overweight before they got pregnant, or if their blood sugar, blood pressure, any of those other things are starting to go up, they should think about whether sleep apnea could be playing a role with that. Another time when postpartum, there's big hormonal shifts. There's a new baby, there's sleep disruption from having the responsibilities of the baby, but the hormonal shifts themselves can also make it harder to sleep. And that may be associated with higher rates of postpartum depression. I mean, sleep is huge, and it's multifactorial. There's no one thing. It's the caregiving roles, it's the new baby, it's the sleep disruption if you're nursing, it's the hormonal shifts, but it's also important to pay attention to that. The menopause transition is another huge time when there's a lot of shifts in sleep. Hot flashes, night sweats can disrupt sleep. Sleep apnea goes up about fourfold in prevalence, and we think in part that has to do with changes in the elasticity of the tissues that are keeping the airway open. And it's easy to say, oh, well, of course you're not sleeping well because you're in menopause, and that's why you're gaining weight, and that's why you're feeling more depressed and anxious, but we don't want to miss the emergence, again, of sleep apnea. A couple of other things for women, just caregiving in general. And I know these are big stereotypes. I don't want to say all women caregive and men don't. That's not what I mean. But usually, or very frequently, the taking care of the kids, taking care of an aging parent, a lot of that does fall to women. And that caregiving stress alone can also interfere with sleep. Or, I mean, I know for me, I don't know if you experienced this, Maya, when your babies are little, you lighten your sleep because you're always listening to see if they cry or if they need you and you get up to nurse. So some women, that becomes a learned pattern. And even once the kids are sleeping through the night, they're still kind of scanning the environment for noise, or do I need to be on alert? Do I need to go respond to somebody? So it's complicated. It's complicated, but there's lots of reasons.
So I understand how mothers can actually sometimes never fully rest. So last year we adopted a small dog, a miniature pincher. And one day the dog hops on our bed and my husband just allowed it. And I love him. I don't have a problem with him. He's a little dog. He's like 10 pounds. And at that moment, my sleep was no longer a full, well rested, like 8 hours of sleep, uninterrupted time. And he sleeps right here next to me. Like, not so much my husband, he's right here on my pillow, like he rests his head on my pillow. And so I think he's so adorable. I love him so much. It's the first time I've ever had a dog in my life. I wonder how many people in general are affected by their pets, their animals.
You know what? That's a great question. And it probably wouldn't surprise you to know that they actually did a study. They did a study with dogs and they're humans, and they put the equivalent of a Fitbit on the dogs and the humans. And since you're a dog owner, it probably wouldn't surprise you to hear that the dogs seem to sleep just fine, regardless.
Oh my God. It's crazy.
And for the humans, it was highly variable. So it's not that it's bad or good to have the dogs in bed. Some people slept fine. Others, it depended on how much the dog was moving, how big they were, whether they're sleeping right here. I don't think they're ever going to do the same study in cats because everybody'd probably get rid of their cats.
I feel like there are people that can have those strong boundaries of it's my time and I'm going to respect and honor my sleep time. And then there are the people that are always wanting to do everything and they burn the candle on both ends. And that really affects our sleep. And yes, so I feel like we as women sort of put that last, like, okay, I'll get to sleep when I get to sleep.
You know what? I think you're bringing up a really important point, because I think I had mentioned it in the context of, I'd mentioned it in the context actually of work and physicians. Physicians are notorious. I mean, people used to brag about, I stayed up all night and look at me, it was sort of a badge of honor. And I think that is slowly shifting, at least for individuals, but the culture hasn't caught up yet. But to your point, I do think that if you are somebody who takes on the responsibility of looking after everybody else in your life and putting your own needs on the back burner, it's very easy to see how that can spill over to sacrificing your sleep to be there for the people that need you. And some of that is, I loved what you said about boundaries. I think that's really, really important. And sometimes it's about just recognizing that if my goal is really to be able to show up for the people in my life that I love and that I care about, when I'm rested, when I feel good, I'm going to have more energy to actually accomplish exactly what my goal is. So sometimes it's reframing it instead of feeling guilty about the sleep. It's setting those boundaries, but also connecting it to what your ultimate goal is, which is if that's something that you value about yourself, that's great. How can I achieve that? And I think ensuring good quality and quantity of sleep is one of the best things you can do around that.
So, Dr. Geyer, can you tell us what happens when we're sleep deprived? How are we affected overall?
Yeah, so it's interesting because I don't have a picture of the actographs of the different stages of sleep, but there's sort of two interesting pieces about this. There are different stages. About 50% of sleep is light sleep. We don't quite know what light sleep is for. About 15 to 30% is rapid eye movement sleep, which is when a lot of our dreams occur, and we'll talk about that. And another 15 to 30%, depending on the person, is deep sleep. So deep sleep is the one that seems to play the biggest role in physical recovery. Like if you've gone to the gym and you've worked out your muscles and you go to deep sleep and you rebuild those muscles so you can come back the next day. We secrete anti-inflammatory molecules in deep sleep, and it's paying back the sleep need that you accrued during the day. And a lot of that deep sleep, most of that deep sleep happens the first half of the night. So we go through cycles. We'll start with light sleep, then deep sleep, and then cap it off with rapid eye movement sleep. And in rapid eye movement sleep, we get partially paralyzed. Our muscles lose their tone, in part to keep us from acting out the dreams that we might have. And it also means in rapid eye movement sleep, um, the work of breathing is coming mostly from the diaphragm. We can talk about the importance of that in a few moments. And one cycle through light sleep, deep sleep, and REM is usually about 90 minutes. Some people will briefly wake up after that cycle, but not be aware of it, and then they'll go into the next one. The second half of the night, we've kind of paid back that sleep need, and the cycles of REM get longer. So there's a lot more dream sleep and REM sleep in the second half of the night. And I think this may be why, if there's been a lot of, in fact, there was an article, I think, today talking about this notion of a first sleep and second sleep. Dr. Roger Ekirk, I'm not quite sure how to pronounce his last name. He's been looking at how societies described sleep before the industrial era. And a lot of them talked about being asleep for 4 hours and then being up and maybe reading something or having relations with their partner or doing some light housework and then having a second 4 hour block of sleep. And it's not clear if, lots of societies. So it's in Victorian literature, it's in a lot of other things. And one of the questions is that how we're really designed to sleep? Well, if you go back and you look at sleep stages, that first half of the night, we've kind of gotten more restored and from a tiredness perspective. That second one is important as well, we think, for mental and emotional recovery. Here's how I would frame it. If you wake up after 4 hours and it's hard to fall back asleep, that may be normal. And if just shifting it to think of it as, oh, maybe I'm sleeping like they did back in the Victorian era, and you don't pathologize it and don't get anxious about it and say, okay, what am I going to do with this time that I'm awake? I'm going to do some breathing. Maybe I'll do some yoga stretches. And then if it allows you to fall into that second half, that can be a benefit.
I wonder if you can then maybe talk about siestas and naps and how that may contribute to sleep deprivation, disrupt our patterns. Is that good as we age?
And that's another great question to which there's probably not a black and white answer, but there are some cultures, especially cultures where the weather is quite hot, where they have a different pattern of phasic sleep. They'll have maybe 6 or 7 hours at night, and then they'll have a 2 or 3 hour siesta in the afternoon, where you may not sleep, you might just rest. And that for some people can work really, really well. There's also the subset of people who will take that 20 to 30-minute nap in the late afternoon, which goes a long way towards restoring alertness if you didn't get enough the night before. And here's what I would say about that. For some people, it works really well. But here's how it can backfire. You only get 5 hours of sleep, or maybe you've got undiagnosed sleep apnea and you're dragging through the day until you can finally crash for a couple of hours. And then you wake up and now your circadian rhythm is off and you're sort of discombobulated and you're sleepy, but you try to go to bed at 10 and you can't go to sleep. It can backfire. So it's a little complicated, but there is a time and a place to forgo the nap if you're trying to increase that sleep need enough that when you go to bed at 10, your desired sleep time, you'll be able to fall asleep. I think if somebody is interested in trying to explore a nap to help them with a night that was a little too short or didn't get the quality they wanted, the 20 to 30-minute nap seems to give you the most bang for the buck in terms of restoring your alertness without necessarily lowering your sleep needs so much that you can't fall asleep that night. And the timing of it should be when there's a normal increase in sleep urge for everybody, whether you've slept well or not, that all of the listeners are probably familiar with, around 2 or 3 in the afternoon.
Also, just a kind of a quick question on this, it might be another topic as well. Are dreams a reflection of how deep we go in our sleep? I find it interesting that some people don't dream. I dream all the time, very vivid dreams. Can you speak about that?
Yeah, and that's another great question. So there are lots of people who say they don't dream, and when they actually put them in a sleep lab and they've got the EEG leads on, so you can tell when they're going into REM sleep, they are dreaming. They just don't remember them. So remember, there's the deep sleep and there's the REM sleep, and they're equally important, but for different reasons. We think that we're also, I mentioned mental and emotional processing. There's some evidence that in dream sleep, we're sort of, um, it's involved in creativity. We might be taking things we learned during the day and comparing it against past knowledge. So trying to make sense of things. And a lot of people, if people wake up after that REM bout, because that's the end of a sleep cycle, if you attend to what you were dreaming and write it down or think about it, you may be more likely to remember it. But if you go back into the next cycle, you may not remember it when you wake up. So the fact that you're a very vivid dreamer, I think that's great. And I'll tell you, I've actually had, when we talk about positively reframing things, I've worked with a couple of people who they got their best ideas in the middle of the night. It was kind of like waking up after a dream with this eureka. And instead of saying, oh my gosh, I'm awake, they kept a pad and paper by the side of their bed and they would jot it all down. And then it was actually a great way to address it, because you don't have to say, oh, I want to remember this. You've written it down so you'll remember it, and you've changed it into something that's actually to your advantage. Do you ever jot your dreams down?
Used to. I dream sci-fi. I always say that to my husband because he's very much into sci-fi. My dreams are amazing. So now, what happens if you were touching on the fact that when we're sleep deprived, we're affected in many ways, and I
Yeah.
find it interesting that depression, anxiety, things like that can be part of that vicious cycle when we're not sleeping well.
Yeah, and I think one of the terms that I just love thinking about is this bidirectionality. What comes first? Is it the sleep that causes the health issue? Is it the health issue that causes the sleep problems? And it can be both. It can be very bidirectional. Anxiety is a really good example of that. So if you are somebody who is struggling with anxiety, it can be really challenging to get to sleep. Um, just as a side note, that's been during the COVID pandemic. There has been a huge uptick in both anxiety and insomnia, and they're kind of fueling each other. Not surprisingly, women more than men have experienced that as well, a disproportionate number of women, for probably some of those reasons that we talked about before. So, so if somebody is having both anxiety and sleep issues, you actually need to address both. But if the sleep is better, the anxiety is likely to be better. If the anxiety is managed, it'll help with the sleep. Another bidirectionality component is cardiometabolic risk. So when we look at high blood pressure, prediabetes, diabetes, insulin resistance, heart disease, we know that people with those conditions have a higher prevalence of sleep apnea, insomnia, dysregulated circadian rhythm. The sleep apnea one's probably the best framework to look at. So people say, well, it's the weight. If people who are overweight are more likely to have hypertension or high blood pressure, high blood sugar, prediabetes, and they're more likely to have sleep apnea. But when they've done some really interesting studies in people who don't have either condition, wake them up after 5 hours a night and do it for 2 weeks, for example, you find that after 2 weeks of 5 hours a night, stress hormones are higher, glucoses are higher, insulin levels are higher. So there's a physiologic impact of sleep deprivation on how our body can regulate blood sugar and stress hormones and inflammation. 2 nights of sleep deprivation, people's hunger hormones went up. And when they put them in a functional MRI to kind of look at how the brain navigated its food choices and showed pictures of highly processed food, they found that when people were sleep deprived, their brain lit up more in the anticipation centers when they were shown pictures of those highly processed foods, and the frontal lobe that we usually think of helping us navigate our decisions and make the one that's going to be the most healthy was actually downregulated. So that to me argues that the sleep is fundamental for some people in making it more likely that they're going to eat the foods that are going to contribute to weight and have more insulin resistance and more high blood pressure. So it's this two-way street. And I think the third one is the bidirectionality with our other lifestyle medicine pillars, right? So at least in my experience, if somebody's trying to change their diet or get on an exercise program, they want to incorporate more fruits and vegetables. If you're exhausted, it's really hard to do that. So sometimes helping somebody sleep better, improve the quality, quantity, and timing of their sleep, may actually make it easier for them to stick to their intentions. And Remember how we mentioned at the very beginning, light is not the only thing that alters our circadian rhythm. When we eat and when we exercise also has a big impact, especially the timing of meals. So I don't know who else has been on, if anybody else on here has started to talk about food and the timing of eating, but our hormones have a circadian rhythm like insulin's. And there's also growing evidence that when we eat regular meals, a earlier dinner, create a little bit of a window between dinner and bed, that also matches that whole circadian realignment. But when we're snacking all the time between meals and eating late at night and watching TV, that's also interfering with our ability to go to sleep and stay asleep. So I remember Dr. Deddy saying years ago, when people are having trouble sleeping, they're usually thinking about what they were doing the hour before bed. But everything you do during the day and when you do it is going to influence your ability to go to sleep and rest when you want to.
It makes sense why quality of sleep improves when you're away from your home, for example, at a campsite. We have a sailboat, and from time to time when we are on the sailboat and we're out and about, we sleep much better. It seems like as soon as the sun is starting to go down, we're feeling like, okay, we're going to go to sleep in a couple of hours because of the activity that we've experienced throughout the day.
I like the idea of the sailboat too, being outside, being active, getting more in the rhythm of the sunrise and the sunset. I bet you in the summer you probably wake up pretty early if you're on the boat in the summer.
And I'm not an early bird, or however you say it, I'm not an early riser like you were mentioning that earlier.
Yeah.
I wanna be one of those people that wakes up at 5 or 6 and it's like, "Welcome world, I'm here." I wanna be that person. Now I've sometimes heard that that is becomes easier as you age. I don't know. You talked earlier about sleep apnea and how that's,
Mhm.
underdiagnosed in women because we tend to present those symptoms more during the daytime.
We have a stereotype about how sleep apnea presents, and it's usually a gentleman with a big neck who puts his weight in the middle, snores and gasps and snorts and wakes up at night. Women, interestingly enough, their predominant symptoms may be what you were just talking about in the day. They might present with anxiety and depression or fatigue, which could be any number of things, or things like fibromyalgia. I mean, there was a study several years ago that found unrefreshing sleep was one of the strongest predictors of the development of fibromyalgia, widespread chronic pain and tender trigger points and fatigue. So I know I sound like I am really on a bandwagon here, but I think it always needs to be on the radar when we're thinking about people showing up with those symptoms. Could disrupted sleep, and it doesn't have to be sleep apnea, could it be just poor quality of sleep or not enough sleep that's showing up with these other symptoms?
So, how is it then with autoimmune disorders that women in general are impacted?
That data is emerging, because if you look at people who have autoimmune conditions, which again disproportionately affect women, there's a higher prevalence of sleep disorders, sleep apnea, restless leg syndrome, which you mentioned, and insomnia. How much is chicken and the egg? It's tough to tease out. Some data suggests that disrupted sleep has been associated with more flares and more symptoms, particularly in rheumatoid arthritis, which does make some sense, especially since we think of sleep as when we're doing a lot of our tissue recovery and reducing inflammation. But the condition itself, most autoimmune conditions, when they're not well controlled, there is a lot of associated inflammation. And inflammation also has a negative impact on quality and quantity of sleep. And many of these autoimmune conditions, joint pain, muscle pain, which can make it harder to get a good night's sleep. So it's another one of those that you have to address both. You have to um, work with the rheumatologist to get the autoimmune condition managed and controlled. Diet and lifestyle plays a big role with that, but also making sure that you're attending to quality of sleep because it's associated with fewer flares and fewer symptoms.
Okay, that's perfect. I'm so glad you mentioned that. We just really need to take care of ourselves. So, can we talk about solutions? This is the part that I love about
Yes,
lifestyle medicine. What can we
yes.
do to help ourselves sleep a little better?
So the very first thing I think we touched on at the beginning, number one, honor the importance of sleep as not being wasted time, but as foundational for your own health and well-being and resilience and ability to do all the other things in your life that you love and enjoy. That's priority number one. And that may mean carving out the time and setting boundaries around other people in your life, maybe your pet, and then creating an environment that's dark, quiet, cool, conducive for rest and relaxation. And I personally am like you. I think no electronics in the bedroom if you can do that, ideally. Even having your phone next to your bed, if it's something that you're aware of and you pick it up, that's going to interfere with quality of sleep. If you look at your bedroom, do it with a critical eye. See if you've even got chargers that are emitting little lights from the charger, because even that little bit of light from a charger can interfere with continuity of sleep. An eye mask is a great solution for that as well, sleeping with an eye mask. Dedicating enough time creating the environment in the sanctuary. Build in a wind down routine for rest, and sometimes shifting the focus towards rest as opposed to sleep. So it's not like you go, 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 hop in bed and flip a switch and you're out, right? So think about how you're going to ease into that restorative phase. And that might mean building in a ritual such as doing some breathing practices or journaling or restorative yoga postures that are taking a nice warm bath. One of my favorites is a bath and some Epsom salts and maybe a little lavender. You can get lavender infused Epsom salts. Do a little stretching in the tub and then come to your cool bedroom and you can ease into sleep. Some people like to, as I said, a journal, a gratitude journal. So think about something that you're grateful for the day. Remember what we said earlier on about setting up your day to set up your night. So ideally, with a few exceptions, you want to end dinner, if you can, 3 to 4 hours before bedtime. There are some people who might need to have a snack. Women who are pregnant, for example, people with type 1 diabetes who are prone to blood sugar swings or need to take medications at night. And if you do need to have a snack at night, low fat, not a lot of processed carbs, not a lot of calories, just something small. Exercise, study after study shows that exercise helps quality of sleep. But for some people, vigorous activity too close to bed might be too revving. So you may want to steer that earlier in the day and then think about something that's more quieting and restful, like yoga or meditation or Tai Chi, something like that, that's a little more calming to ease into bed. The lights, if I had to pick a window for your screens before bed, if people could at least give an hour of no screens before they go to bed, that'd be great. If they could do 2 hours, it'd probably be better. The data about food, we talked about the timing of eating, but it probably wouldn't surprise you to hear that eating a high-fat, high-glycemic processed diet, independent of the timing of it, is associated with worse sleep quality, more awakenings during the night. Whereas eating more fiber-dense foods and beans and lentils and whole grains and fruits and vegetables is associated with better quality and quantity of sleep. So it's kind of nice to know that all those other lifestyle pillars are going to help improve your sleep quality. I do sometimes use melatonin if somebody is trying to shift their circadian rhythm, along with all those other things that we just talked about. If you're trying to change your internal clock on your own, you can probably move it about 30 minutes forward or back every 3 or 4 days. If you're trying to do it more quickly, then melatonin can kind of help in some people jumpstart that. A couple of caveats about melatonin: it's not regulated, so you need to make sure you're using a good product or getting a good recommendation. The most common side effect is very vivid that I've seen is very vivid dreams, interestingly enough. And for some people, I don't mean creative dreams, I mean disconcerting, unsettling dreams. So people need to be aware that not everybody can take melatonin. So talk to your clinician about that. I think that's the best thing. And 2 things we didn't talk about that I think need to be brought into this conversation are caffeine and alcohol. So caffeine, everybody is different in terms of how quickly they metabolize caffeine. Some people kind of know where they are, but for slow metabolizers of caffeine, you could even have caffeine on board in your body at 10 o'clock at night from your noon cup of coffee. So if somebody's really having a hard time falling asleep or staying asleep, we're going to talk about peeling back the caffeine, drinking less and having it earlier in the day and none after noon or 2 p.m. Alcohol, I think to this group, probably people understand the impact of alcohol on sleep, maybe not, because people use it as a sedative. Like, oh, I have a drink of wine and it helps me fall asleep. But unfortunately, if you have sleep apnea, it will make it worse. And the sedation from the alcohol wears off about an hour after one drink. And then there's actually a rebound arousal. So people might fall asleep with alcohol and then wake up a couple hours later. And when you look at the research on impacting those stages of sleep, it's less deep sleep, more awakenings during the night, and the quality is not as good. So I really think it's prudent to limit or avoid alcohol. The closer to bedtime you drink it, the more impact it's going to have negatively on your sleep quality and quantity.
You've mentioned other ways that we can relax, like yoga, meditation.
Mhm.
So you said journaling. Now, what would you say to an individual who has tried many of these lifestyle changes and has, like, I don't know if you would call it like acute sleep deprivation, but a very, very advanced case?
They need to see a sleep specialist. If you've tried all that stuff and you are still struggling to fall asleep, stay asleep, or you're waking up unrefreshed, you really need to talk to a sleep specialist, because I think that person probably needs more information to figure out exactly what's going on, and probably a sleep study.
Do we know like what contributes to
Yep.
restless leg syndrome?
So, restless leg syndrome is another aspect of sleep or condition that can interfere with sleep that disproportionately affects women. There is a genetic component to it, and it's what we call a clinical diagnosis. So, restless leg syndrome, people often describe this creepy, crawly feeling in their legs and feet, or an irresistible urge to rub their feet together or splay their toes or walk around. And it happens at night when you're trying to unwind or get ready for bed. And it sounds funny, but it's not. We also know that restless leg syndrome can overlap another condition called periodic limb movements. When somebody's asleep, you diagnose this in a sleep lab, and they're flip flopping and tossing and turning and flailing around during the night. One of the reasons there can be a nutritional component to restless leg syndrome. One big one is iron, which could be one of the reasons why women are more likely than men, especially before menopause, to get restless leg syndrome, because they can lose iron with their periods every month. And it's also more common in pregnancy. So if somebody has that symptom, we want to make sure we've looked at their ferritin levels, their total tissue iron levels. And if it's low, figure out why it's low. And there's a therapeutic target for ferritin that's different than just being normal. The low end of the reference range for ferritin is around 11 to 15, depending on the lab. And if somebody has restless leg syndrome, we may try to get them closer to 75 to 100 to see if that helps their symptoms. Restless leg syndrome has also been associated with vitamin D deficiency. Not uncommon this time of year, certainly in Western Massachusetts where I live. So we might also want to look at vitamin D. It's more common in inflammatory conditions. So women or men who have an autoimmune condition might have more restless leg syndrome, might have more restless legs. It can be tough to treat. So we want to look at the nutritional component. There's some evidence that stretching, again, that lavender, that Epsom salt bath and stretching in the tub might help. There are pharmacologic agents to help as well, but they have side effects. So that, again, would be a conversation to have with a sleep specialist if it's really impacting quality of life. But I think starting with the lifestyle factors first.
That's great. And you touched on vitamin D, which I was curious about. Low levels of vitamin D could impact restless leg
It could.
syndrome. Well, what about exercise? Does that help a little bit with restless
Yes.
legs?
Yes, it does. And then the stretching before bed. So they both can help.
This has been wonderful. So much information that our listeners are going to appreciate. So, you're very passionate about helping other practitioners understand the importance of sleep, how to diagnose sleep deprivation, and also how that impacts women's health. We really appreciate all the work that you're doing. Last year, I was sharing with my listeners about the conference, the Lifestyle Medicine Conference, that almost happened in the Dallas area. So, this year it'll be in Orlando. Fingers crossed still.
Fingers crossed. Yes.
Actually, if you'd like to share with our listeners, I do like to emphasize the women's interest group, but anything else that you'd like to say about what you're working on?
Sure. So I'm the co-chair along Dr. Michelle Tollefson, who's been on the podcast. She was the founding leader of the Women's Health Member Interest Group, and now we call her the emeritus, the grandmother of the group. I'm now co-chair along with Dr. John McHugh. And our group is really busy and active. They're doing a lot of things, which I think is fantastic. I think our membership is up to close to 250. And I think it's okay to say this. I'm not presenting this year, but 3 of our members did submit a proposal that just got accepted for a pre-conference workshop. So I'm so excited. And I think it's focusing on self-care for women and exercise. That's Michelle Thompson and Kaylee Anderson. We just found out that got accepted. So we're really excited.
Awesome.
So if you're going to the conference, please sign up for the workshop. That'll be great. And one of the other things that many of our members are working on, which I think is also equally important, is working on patient-facing handouts. So creating tons of materials specific to women's health. I've been working on several regarding sleep as one of the other lifestyle medicine pillars and how it can help polycystic ovarian syndrome. So we have several in the pipeline and several that have already been made available to members of ACLM.
So I'm a lay person. I'm not really a health coach. I consider myself a health educator. And that's kind of how I got started with all of this, is wanting to inform our patients, my husband's patients, about things that they can do to take control of their health. But I become such a fan of the American College of Lifestyle Medicine. It's incredible work that all of you are doing. I'm a big, big fan, especially the women's group. So we know that so far, the American College of Lifestyle Medicine's annual Lifestyle Medicine Conference will happen in Orlando, Florida. So who can attend and how can they learn more about it? And by the way, who goes to these conferences?
Yeah, you know what? The numbers have been growing every year. It started as a predominantly physician organization years ago, but really expanded to include a multidisciplinary team. There's a dietitians group, there are health coaches, there are an exercise and fitness group, there are nurse practitioners, nursing. So we actually really have grown in leaps and bounds, and even people who aren't necessarily clinicians, but just like you, are passionate about the power of lifestyle medicine and want to stay involved and be inspired. And I would encourage anybody for whom this is a passion to think about coming, because the connections, the excitement, the passion, the education, there's something for everybody. And just being around people who share your passion and are like-minded is just amazing. So I think anybody who's interested in lifestyle, it's a great place to get the latest and greatest information and the emerging science and all the work that's been doing to address health inequity and to even go into hospital systems. So we're going to change the world.
The lectures are amazing, and the energy is so beautiful among the attendees. Coming together is so special, and so I'm looking forward to it this year.
Me too.
Dr. Geyer, this has been wonderful. I thank you so much for taking the time to inform our listeners, especially our women, on how we need to practice self-care by making sure that we put sleep first, or at least, quality sleep. So thank you so much for being here.
Thank you for having me, Maya. It's a pleasure.
Thank you.
Take care.
You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this podcast, do us a favor and share with one friend who can benefit from this episode. Feel free to leave us an honest review on Apple Podcasts. That helps us to spread our message. You can also head on over to podinbox.com/HLS to leave me a voicemail. Don't forget to subscribe. And as always, thank you for listening.